Hello and welcome to this presentation which will explain how the staged implementation of the new Public Health Act 2016 will occur. The Public Health Act 2016 received royal assent on the 25th of July 2016 and became law in Western Australia. A significant amount of work is now required to transition Western Australia from the old Health Act 1911 to the new Public Health Act. Implementation of the new Act will occur in a staged manner over the next 3 to 5 year period. This means that the old Health Act 1911 and all regulations made under the Health Act will continue to be the main enforcement tool until the provisions of the new Act come into effect over the coming years. We now have two Acts, the Public Health Act 2016 and the Public Health Consequential Provisions Act 2016. The Consequential Provisions Act provides for the gradual repeal and replacement of the Health Act 1911 and the amendment of other pieces of legislation that make reference to the Health Act. The implementation of the new legislation will occur in 5 stages. Each stage will come into effect on a date fixed by proclamation. That is, each stage occurs on one day rather than being rolled out over a period of time. Different provisions of the Act will come into effect at each stage. Stage 5 will have the most implications for local government. It is anticipated that the entire Act will be operational between the years 2019 to 2021. Stages 1 and 2 have already occurred. Stage 1 occurred on the day of royal assent and Stage 2 occurred the following day. Stages 1 and 2 should be considered business as usual for local government, who are to continue to enforce the Health Act 1911 and subsidiary legislation. On this slide, we can see the Health Act 1911 and the new Public Health Act alongside each other. The parts of both acts highlighted in bold black text are in force. At this stage, the entire Health Act 1911 continues to remain in force. The Public Health Act has not been enacted in its entirety yet, so only those provisions relating to the Part 1, which includes the title of the Act and the binding of the Crown, Part 17, related to Crown exemptions, as well as some provisions under Part 19 and 20 are enacted. The parts of the Public Health Act in light grey are not yet enacted. While these introductory stages will have no practical implications for local governments will need to start preparing for Stage 3. Stage 3 will occur on a date fixed by proclamation, although it is anticipated this will occur within 6 months of the date of Stages 1 and 2. When the date of proclamation is known, this will be communicated to local governments. During Stage 3, key elements of the administrative framework provided by Part 2 of the Public Health Act will come into operation to replace the equivalent administrative framework provided by Part 2 of the Health Act. This includes provisions establishing the Chief Health Officer and enabling enforcement agencies to designate authorised officers for the purposes of the Act. At Stage 3, the Health Act 1911 and its subsidiary legislation will remain in place, so it should largely be business as usual for local governments. 6 pieces of subsidiary legislation outlined on this slide that have been identified as no longer being required will be repealed at this stage. Amendments will be made to the Health Act 1911 and to a range of other acts to provide consistent terminology with that of the new Act. The Health Act 1911 will be renamed to become the Health Miscellaneous Provisions Act 1911. References in that Act and other legislation to the Executive Director, Public Health, will be changed to the Chief Health Officer. References to medical officers and environmental health officers will be changed to references to medical practitioners and authorised officers, respectively. To prepare for this stage, local governments should identify all persons who hold a current appointment as an environmental health officer. Issue to each of those persons a certificate of authority in accordance with Section 30 of the Public Health Act. Prepare and maintain a list of those authorised officers in accordance with Section 27 of the Public Health Act. The Department of Health has prepared an information sheet on the appointment of authorised officers to assist local governments at this stage, which can be found on the Department of Health website, www.health.wa.gov.au. Persons who are currently appointed as Environmental Health Officers under the Health Act 1911 at the time when Stage 3 is proclaimed will automatically be recognised as an authorised officer, but an enforcement agency will still need to issue each person with a Certificate of Authority card. Any person appointed after the commencement of Stage 3 must hold approved qualifications and experience. The Department of Health has prepared an information sheet on the appointment of authorised officers to assist local governments at this stage, which can be found on the Department of Health's website, www.health.wa.gov.au. At this stage, the Chief Health Officer will publish guidelines in the Government Gazette which outline the qualifications and experience required to be designated as an authorised officer. As the Health Act and its subsidiary legislation remain in force at this time, the first guideline will require persons that hold approved EHO qualifications. Once new subsidiary legislation is passed, the guidelines will be updated and persons with other qualifications will be able to be designated as authorised officers. Stage 4 is expected to occur approximately 12 months after Royal Assent, so around July 2017. At this stage, provisions in the Public Health Act relating to Part 3, General Public Health Duty, Part 4, Serious Public Health Risks and Material Public Health Risks, Part 9, Notifiable Infectious Diseases and Related Conditions, Part 10, Non-infectious diseases and physical or functional abnormalities, Part 11, Serious Public Health Incident Powers, and Part 12, Public Health Emergencies will be commenced. Part 13, Compensation and Insurance. Part 15, Inquiries. Part 16, Powers of Entry, Inspection and Seizure all come into operation. Equivalent provisions in the Health Miscellaneous Provisions Act 1911 and regulations made under that Act will be repealed. No action is required by local governments to implement this stage. At this stage, 6 current pieces of subsidiary legislation will be repealed and replaced with one new regulation, which prescribed those conditions for which mandatory notification are required. The implementation of the provisions related to the public health emergencies and serious public health incident powers is being managed by the Disaster Preparedness and Management Unit. Further information in relation to this stage will be available as it is developed. Stage 5 will occur on a date fixed by proclamation but is expected to occur between 3 and 5 years after proclamation. Stage 5 will be the most significant stage of implementation for local government. It will be the point at which local governments move from the framework provided by the Health Miscellaneous Provisions Act 1911 to the framework provided by the Public Health Act. Provisions in the Public Health Act relating to public health planning, assessments, registration and licensing will be commenced along with the enforcement provisions. Here we can see that the Public Health Act will have been enacted in its entirety. The sections of the Health Act which are in black text are those that will remain in the Health Miscellaneous Provisions Act 1911. The requirements related to public health planning will be enacted. The first state public health plan must be produced within 12 months of Stage 5 being enacted. That is, if Stage 5 occurs 3 years after Royal Assent, the first state public health plan must be published within the following 12 months. The first local public health plans must be published within 24 months of Stage 5 being enacted. It is at this stage that new subsidiary legislation related to environmental health will be enacted and the old subsidiary legislation will be repealed. There are currently 22 pieces of subsidiary legislation that sit under the Health Act 1911 related to environmental health. For each new piece of subsidiary legislation, the Department of Health must research the area of concern to identify known and emerging issues, current best practice, and how the issues are managed in other jurisdictions and countries. Publish a discussion paper for public consultation which outlines the findings of that research and proposes options for the future management of public health risks. Consult the Regulatory Gatekeeping Unit to advise on the proposed content of any new legislation and draft the new legislation. Local governments and key stakeholders will be consulted at each stage of the development of the new legislation and are encouraged to take an active role in their development. It is proposed that the existing 22 regulations are replaced with a streamlined, more manageable number of new regulations. It is proposed that these will be related to the areas of the built environment, body art and personal services, pesticides and biting insects, water, public health assessments, and events. People working in local government are encouraged to familiarise themselves with the new legislation, particularly those areas relevant to their work, and also consult the explanatory materials available on the Department of Health website. Local government should also identify those staff who need to be designated as authorised officers in preparation for Stage 3. If you require any further information in regard to the new legislation, it may be found on our website at www.health.wa.gov.au. Alternatively, please contact the Department of Health with any questions by emailing publichealthact@health.wa.gov.au. Thank you for watching this presentation.